Group 1 got a chance to travel to the St. Jude's Recovery Center at 139 Renaissance Parkway, located in downtown Atlanta, to find exactly what the heroin addicts had to look forward to.
We want our viewers to know that this drug is very dangerous and harmful to you, and it can take over your entire life. We had so many questions to ask the St. Jude's vice president, but these things he told us stood out to us the most.
Okay, so how often do the doctors come in and see the patients here?
They see everybody on arrival, and then they usually probably will see them a couple of times a week while they're here.
Okay, so it's mandatory that they see them every week?
We're under DBHDD, a state agency that regulates substance abuse treatment, and it's a regulation law that the doctor has to see them on admission within 24 hours.
Okay. We asked what were the steps when it came to the heroin addicts to get clean, and he told us they had to come into admission first. They would do an assessment on the patient to determine whether or not to detox them. Once they are approved, in 24 hours, a psychiatrist would test them by advising them to come in to put them to what they call a CAB protocol. It's a detox medication to make sure they don't go into any seizures, and it also lessens the withdrawal experience.
For about 2 or 3 days, they don't leave them alone, but they do keep an eye on them. They don't push them to do anything because they are concerned about the medical conditions. Then after those days, they put you in a group so you can learn just how dangerous it is to become addicted to heroin. The program is about 6 months long when you are put in the residential area.
Detoxification is, in what I'm thinking, what you're talking about is rehab is generally either outpatient or residential.
Mm-hmm.
Detoxification is either coming off of alcohol, benzos, or opiates. You don't detox anybody for cocaine or meth because there's not a medical necessity. Mm-hmm. For detoxification, there should be a medical necessity. On alcohol, you can have seizures and die on. You know what benzos are, Xanax, and Valium and Klonopin is that you can have seizures and die off it. On opiates, you wouldn't die if there's a lot of the medical complications, and the withdrawal is so painful for most folks coming off, especially with, all opiates. I'm not going to say just heroin. But you're really trying to lessen the withdrawal symptoms, and that the client feels so much discomfort that they're going to go back out and use again. Not to have that discomfort, but there's some other things you can come up with coming off of opiates, and high blood pressure and things like that can cause stroke. So there's a need to lessen that stuff. There's also some, while you're going through the withdrawal, is there can be some brain damage at time because of the trauma that people are going through.
Okay, what was your worst experience with heroin addicts?
I've had more than one die.
One died?
Death when they left here, and I'm the person that put them out because they weren't doing what they were supposed to be doing. Then 2 weeks later, they died, and that's the end result of heroin. Normally, is somebody dying, overdose. We've had several overdose. Heroin addiction in Atlanta has gotten really horrible. I don't know if y'all are aware of that. Opiate addiction has gotten really horrible, and there's never a good outcome with it. And that's by far. I mean, that's always the worst. I'm trying to save people's lives, and then having one dies. That's the toughest part.
Okay.
What would you say to the viewers watching that are possibly could be on heroin, but they're saying, oh, I can get off of it whenever. It's easy to get off of it. What advice would you give to them?
I will tell them always to go back and recall, if they would, how many times they tried to quit and said that they could quit on their own, and that whatever they've got to do, that they need to get some help and get off of it. And then results is one of the 12-step programs says jails, institutions, and death, and is the normal outcome for heroin use. And if they want to change directions in their life, they got to do something different.
Okay. Don't let death be your final answer. For more help, please contact your local recovery center or your local drug addiction treatment center.